Hello, my name is John Cruser, and today I'm going to be talking about activity-based costing in the healthcare industry. I've been working in the healthcare industry for the last 4 years, and I work in an ambulatory surgery center where we perform outpatient surgery. Specifically, I work within the billing office for that surgery center. In medical billing, it's a little bit different than how we buy products at a store or at a restaurant. We perform the services and then we have to code that service into what the procedure was and um, what the diagnosis was, and then send claims to the insurance office. And then we'll receive those claims back after 30 days, 60 days, and figure out if the insurance paid in full or if the patient owes some deductible balance, or if we need to appeal or write off the bill or just simply rebill it or send medical records. So there's a lot of options that can happen after a medical bill has been sent in. So activity-based costing is a process in which overhead is applied to a service or a product. Specifically in activity-based costing, it's trying to set up a method of assigning cost drivers using different levels. Those levels can be unit level costs, or the costs that occur for each unit of production, or batch level costs, like the costs that occur once per batch. This for us could be like restocking the OR once per day, or these could be product level costs, the costs to support the product type, in terms of like staffing the waiting room or answering the phones. And there could also just be costs associated with capacity sustaining costs, such as the rent or utilities and other administrative costs. So these would be costs like what I do in the billing office. So these systems are very important for setting prices. We want to know what things cost so that we can, if we have like a self-pay patient, we can set an accurate cost that doesn't just include the surgeon's time and the cost of the sutures that we use, but it also includes everyone that's on the surgical team, as well as understanding that they used the surgical bed. We had to keep the lights on. We had to answer the phones to make the appointment, and we had to clean the instruments, things like that that maybe don't directly look in, but we need to cover those costs. They can be also very important for identifying areas of waste within a company, because activity-based costing, unlike some other costing methods, like costing based off of material usage or labor hours, tries to be more specific about assigning overhead, and so it can identify areas of inefficiencies where that can be then turned around into positive. It's not a perfect system though, because you do need to still make decisions on how to assign costs, and if you assign a product level costs at a system level, that might not be a perfect solution. And there could also be significant cost in your company to keeping track of these records as carefully as they need to be, for this to be a very strong system. So how I want to talk about activity-based costing is through some studies that have been done. These studies are primarily done by Dr. Robert Kaplan, who's one of the leading advocates for activity-based costing within business. And this, for an office like mine, makes it easy for us to kind of get some of the results of activity-based costing practices without having to do the intensive work ourselves. So the study that I'm looking at here was done in 2017 and 2016 across many healthcare systems to look at some of the administrative costs, and this was done by Dr. Robert Kaplan and as a lot of other physicians that he was working with. So in this study, the first thing they wanted to identify was how many things outside of the physician seeing the patient there actually were. So this image is actually showing all of the different activities that could be associated with a patient visit. other than the surgeon or the doctor or the physician seeing the patient. So it shows stuff like appointment scheduling and a lot of admin staff, including stuff that would be done by the physician. And as you can see, it is a lot of activities. So here we see the results of their study where they talk about the total processing time in terms of minutes that each activity takes. And what I want to focus in on is what their results were for ambulatory surgery centers, where they're showing that the billing and insurance-related administrative costs were about 75 minutes for the visit. And that was a total cost of $170. So that's a big portion. And if we look down at the middle of the slide, middle of that column, we see 51 minutes of time spent by the physician. So that's a significant amount of time that the physician can't be doing other billable tasks. So labeling some inefficiencies. Now, where does this leave us for the results of their study? Well, they started off by this paper by saying that administrative costs are about 25 to 31% of United States healthcare costs. And this is about double that is found in Canada. And the growth rate of these administrative costs in the US is significantly outpacing overall healthcare expenditures. As we saw within the ambulatory surgery field, those costs are material costs that need to be considered when billing out to a patient. However, when we're specifically calculating out these costs and using activity-based costing, you can tell it takes maybe a lot of work to be able to get very specific results. So there needs to be a balance between the effort versus the savings. And so how I see it is that understanding that administrative and insurance-related costs can be quite high simply by just reading the results that this study found. It can highlight how we need to make sure we're being very efficient in our practices, in our admin practices. So in another study also done by Dr. Kaplan along with other physicians, written in 2014, they looked to see how activity-based costing, and specifically time-driven activity-based costing, can help to provide some insight into where we can lower the costs of healthcare. So they started their process in a similar spot to the last study I talked about, where they did activity mapping first, and then they combined this with activity-based costing to help. This process helps to outline all the different components which they're going to cost out in their study. One of the key findings that I think is very important from this study is they found that there's a very large disparity in pay across the healthcare team, from upwards of $10 per minute for a physician, all the way down to 60 cents or less per minute for some of the administrative staff. And within this finding, they found that some jobs can be done by both levels and were often performed by the same job performed by different levels within the healthcare team. And obviously, depending on whether the physician or an administrative staff is completing this task, greatly impacts the overall cost of this task takes for the company. So making sure to assign roles the correct way becomes very valuable to lowering costs. And some of the key takeaways for all of this is that within the healthcare setting, understanding costs is very important. Just like I said at the beginning, for assigning the appropriate price for things. However, often the price is determined by the insurance company, and so there's a set rate that an insurance company will pay for a certain service. So it's important still to understand costs and keep costs low so that you are able to perform a service within the boundaries of what the insurance company is willing to pay. However, I do think it is important to understand that we can't lower healthcare costs to zero. So, examining costs is an important takeaway in terms of looking for where inefficiencies might be so that we can lower the costs but still maintain a minimum level of healthcare and we're not forgetting about patient outcomes. So, I thank you all for listening, and I've learned a lot about activity based costing and how it can apply in the healthcare field, and I hope you have too. Thank you.